Reproductive health care is about to look a lot differently here in Idaho. A little more than a month, abortions will be outlawed. There are a few exceptions for health emergencies for the mother and cases of rape and incest that are reported to law enforcement. Whether you agree with it or not, it is expected to be the law of the land, barring any ruling from a court that says otherwise. We know Planned Parenthood in Idaho is shifting resources to just over the border in Oregon, where abortion care will remain legal. But what about within Idaho? Stanton Healthcare, which is anti-abortion and works to provide what they call life-affirming care for pregnant mothers, they held an event this week called Supporting Women in an Abortion-Free Idaho. The event featured the first on-camera comments from Idaho Governor Brad Little about Idaho's pending trigger law. Their clinic will now take on a new role, Stanton Healthcare's, in a post-Roe era here in Idaho. Here's Chief Political Reporter Joe Paris.
So the symposium is titled Supporting Women in an Abortion-Free Idaho. First of its kind, post-Roe, where we brought the community together, faith leaders, community leaders, and lawmakers to discuss and get our minds together about how we as a community and as a state can support women in a state where abortion will soon be illegal, and how we can walk through with women through an unexpected pregnancy and beyond and take care of them, support them, and empower them to make the right choice for their family and to embrace life with that child.
Danielle Versluys is the Chief Operations Officer for Stanton International. The changing of Idaho's abortion laws now puts focus on centers like Stanton, a provider that does not offer abortions. Instead, they tout life-affirming care.
I know there's a lot of what-ifs out there, and of course in Idaho, one of the what-ifs is, what if I need an emergency abortion? Places like Planned Parenthood are no longer next door. Women might have to drive out of state if they're looking for abortion care, and in an emergency situation, they may not have 45 minutes to get to Oregon. In a situation like that, if you were to have someone come into Stanton and say, I think I might need an emergency abortion, what does Stanton offer? I know it's a life-affirming care center, but I guess in these what-if situations, what do you do?
Sure, we don't even blink. A woman comes in and she says, we've had this happen before, and we have women come in and say, I think that I need an emergency abortion, my doctor said, or I don't know what's happening. And we immediately connect them with a doctor who will value their life and the life of their baby and treat them both as patients and do his utmost to save the life of that mom and of that baby. Because we value all human life, not just the moms, not just the babies, we value them both. And whatever situation the woman finds her medically, we need to respond to that compassionately and with a view towards saving both lives. And so we would connect a woman with a doctor who will have that mindset and that attitude.
Idaho Governor Brad Little shared his thoughts at the event in a video message. He touched on the changing laws and the challenges ahead.
But our work has only started. We fully acknowledge the monumental moment in our nation's history means we must confront what we know will be growing needs for women and families in the months and years ahead. We absolutely must come together like never before to support women and teens facing unexpected or unwanted pregnancies. Families, churches, charities, local and state government, and you, the Stanton supporters, stand ready to lift them up and help them and their families.
What do you think is the most important role for Stanton in this community right now in terms of serving a group of women that previously might not have come here?
Our biggest challenge is going to be to make sure that women know about Stanton. And that is why we brought together all these community leaders to say, you need to spread the word too and let them know about the work of Stanton. Not only are we asking them to support the work we do and to volunteer to give, to support and sustain the work we do, but also we need the information about Stanton to get out to the women who are facing these unexpected or challenging pregnancies.
Planned Parenthood reports that a very small percentage of their actual work is abortion care. And I know when Planned Parenthood moved out of Boise, there was concerns from some members of the community. Well, the other services that are not abortion related, who will make that up? Is Stanton in a position to make up the other care that Planned Parenthood did outside of abortions?
Absolutely, and so we provide STI testing, we provide well woman care, we provide after abortion exams, which Planned Parenthood does not. They provide a woman an abortion, she's on her way. Here at Stanton, a woman comes in and says she has had an abortion, we treat her with open arms. We welcome her with open arms, and we provide her with that medical care, critical medical care that she needs to be back on her journey to reproductive wellness. And so we advocate on behalf of family planning that looks at a woman holistically. We help women walk through healthy, green options for family planning. We help encourage them in their relationships, their choices. We encourage them to develop a community network. So we run the whole gamut of services at Stanton. And so Planned Parenthood leaving does not leave a gap. Stanton has been doing this work for a long time. All it does is take abortion out of the equation in Boise. Stanton is still here doing the work we've always done, which is walking with women through their reproductive journey, whether they be pregnant, seeking to become pregnant, post-abortive, or post-pregnancy. And so we will always be here.
It's important to note that for the time being, abortions do remain legal in the state of Idaho. That pending trigger law does not go into effect until later in August. And Brian, I know we've had a lot of questions from viewers at home and also from experts around the state. How is all this going to play out? Well, the first thing we need to watch is the Supreme Court in the state of Idaho. Coming up the first week of August, they're going to start having some hearings on two separate laws that are actually caught up in the court system right now. We have the trigger law, which Planned Parenthood is asking to be paused, and we also have that civil enforcement mechanism that would allow people to sue over, in civil court over what they would say is illegal abortions. Both of those are pending right now. In early August, we're going to get a real indication of when those will go into effect. But the bottom line here is that there's a lot of unknowns, and until some of this plays out in terms of an investigation, in terms of seeing this in court, in terms of seeing, a doctor making a difficult choice, do I provide care or not? We're going to have to wait and see. Nobody knows how this is going to play out.
What I find interesting is a couple weeks ago, Stanton Healthcare was in the middle of something online, but they said they are not a political organization. Yet at the last two events that they've sponsored, including this one here, they've had politicians participate in both of those events. Both Representative Russ Fulcher, and now Governor Brad Little. So it is interesting, and as you said, we'll watch as this thing plays out through the rest of the summer, at least now down to almost 30 days.
Yeah.
All right, thank you, Joe.